At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial health, and we are here. IHM VCU is a proud supporter of WQPT.
Summer is upon us. Is there food for the kids to eat? And a new way to get life-saving blood faster to those who need it in the cities. Seconds count when it comes to most medical emergencies, and now some first responders will be able to give your blood donations to people who need it even before they arrive at the hospital. I'll have more on that in a moment, but first, feeding the kids. The federal government is expanding its summer meal program for children, but Iowa is not accepting any of the $29 million the feds offered. Instead, Governor Kim Reynolds is allocating almost $1 million to schools and nonprofits to serve summer meals and snacks in counties where half the children are eligible for free or reduced price meals. Among those nonprofits is the Lincoln Resource Center in Davenport. Tracy Singleton, the executive director, joined us to talk about the problem and why they felt the need to step in. The Lincoln Resource Center already has a summer meals program. So let's start with that. What is already provided for children in central Davenport?
Well, for the summer camp program, Camp Excel at Lincoln Center, they are given breakfast and lunch, but that is through monetary donations and out of our pockets. And last year was the first year for the summer camp program. So we've really, at this point in time, we're only specifically working with the kids that were enrolled in the summer camp program, which is about 40 kids. So it's still a lot of kids.
So what does the state grant money, or what does the state money mean that the governor has said is replacing what the federal government was going to offer?
Right. So what we're able to do now is offer it to not just the kids that are in the program, but the kids that are in the neighborhood as well. And so breakfast and lunch will be served at the Lincoln Center for anyone that lives within that neighborhood of TNBC Lincoln Resource Center. And there are federal guidelines that we have to abide as far as what we give them. But then this also allows us to leverage a partnership that we have with the Alpha Kappa Alpha sorority and their CHIP program that provides weekend snacks for the kids. So once they leave on Friday, they are still provided with breakfast and lunch meals for the weekend and some snacks. And then we are also able to provide the families within the center meal boxes once a month that will provide them with some extra food. It gets hard, to buy groceries, especially if you have 2, 3, 4 children, and to stretch it. So what we're hoping to do is just give them a little bit extra that will help them provide for their families.
Well, you already got 40 kids in the camp, which is a great camp. But then let's just say you get another 40 kids. That's 80 kids. That's nowhere near the need, is it?
I personally, no. I struggle with the fact that where the Lincoln Center is located, which is in central Davenport, there's nothing in that area. There's not a grocery store, a convenience store, a corner store, a restaurant. There's nothing there for them to get food. And
good quality food.
Good quality food.
That's important.
Right. And so we have to just do our part. We have wonderful programs and wonderful events, but we have a responsibility to the families that live in the neighborhood. If we're calling ourselves a community center, then we have to be there for the community. And so although our focus is that immediate neighborhood, we do get people from around the community that come there. There are food pantries around the area, but we get so many families that come to the center looking for food and for resources for food. So for us to be able to have access to these monies and provide for a greater number than what we can do right now, just doing it on our own, is a blessing to everyone that is going to be able to benefit from this.
Well, and you made a really good point, is that we're talking about children. We're also talking about busy streets and just getting to a place that does provide meals. I mean, you're located in an area that is really helpful for so many different families.
Right. We're in a neighborhood, and This is a neighborhood that's been around for years.
Hmm.
And so and it's all homes. As I mentioned, there's nothing else there. So it's just all homes. It's all families that live in this neighborhood. And prior to the Lincoln Center being a mill site, the closest one was 1.8 miles away. And that is either going across Brady or Locust to get there. And if you go for breakfast and come home and then go for lunch and come home, that's a 12-mile trip every day just to eat healthy meals. And so I'm glad that we were able to be there. It took a lot of advocating. It took a lot of just having conversations to say, this is where we're there for a reason. Right. And maybe I didn't know the reason when I first started working there as executive director, but the community will let you know what they need. And when they let you know what they need, then we have to do our best to make sure that we're able to provide that for them.
Well, and that's kind of the way you want it to be, is
Exactly.
that it's true grassroots, and it's true servicing the needs that are needed.
Right. We're a community-driven community center. We have a mission, but we have to listen to the people that live there.
You know this firsthand, because I mean, people always talk about if kids don't get breakfast or if kids don't get lunch, if they're hungry and it becomes almost chronic that they're hungry every single day, there's so many other aspects of their life that are impacted.
Mm-hmm. There are direct links to everything that comes down to the source of it being poverty. Poverty is a direct link to education, a direct link to crime, a direct link to livability. And so if we can start providing resources that alleviates some of that poverty, some of that stress. I was a single mom of 4. I understand. I was there. I get when you have to decide, am I going to pay this or am I going to buy groceries? Am I going to fix my car or are we going to buy groceries? You know, I've been there. And I mean, maybe that's why it's easier for me to fight for these resources, because at some point in time, someone had to help me. And so that's how the Lincoln Center is trying to do, is just provide that help, that extra layer of security that families need. There is, the term working poor is very true. You can work and work and work and work and still not have enough to take care of just your basic needs. So at the Lincoln Center with this meal program, we are just trying to provide an extra layer of security for those families.
The other thing about the Lincoln Center, and I think one of the key words that you always have, I notice on your website and a lot of times in the description, is empowerment.
Yes.
Because and when you think of empowerment, you do think of adults, but it's also for children as well.
Mm-hmm. Our mission is very simple. Our mission is to educate and empower our youth, our families, and community through opportunities. I do believe that there are academic gaps and achievement gaps, but that's because there's lack of opportunity gaps. There are definitely those gaps. And if we can provide those opportunities for our families to learn, to participate, to engage, to understand, then hopefully we've given them these opportunities so that the starting line is even. Everyone's starting at the same starting line instead of having all these barriers and disparities that put you back behind the pack. We're trying to get everyone to the same starting line.
But it also offers a bit of a safety net and also a bit of a push in some ways. And the reason why I say that is because one of the great things about the Lincoln Center is the incubation aspect of it, the small businesses that you have, the people that just need a little bit of a roof over their head and the ability to work with other people that are just like them, starting a business and trying to get going. How's that been going?
That has been going wonderful.
Because you have such a long list of people that participate.
Right. We are currently at 18 businesses within the Lincoln Center. And our goal is to have them outgrow the space and move on. And we have had that. We have had a few that have outgrown the space and have moved on to bigger spaces, which has then allowed for other businesses to come in.
Right.
And so
they're learning from each other too, are they not?
That's the main thing. You will see them talking to each other, collaborating together. We are getting ready to open a nonprofit co-work space for our Black nonprofits that don't have an office setting where they can come and they can collaborate together and work together. I always am I'm a true proponent of believing in bigger. And if I have the hope that we can always get bigger, right? And so we have this incubator program, but not only that, we work very hard to try to support as many Black-owned businesses as possible within the Lincoln Center. And so our contractors, the people that come in and do the work, we're putting money back into the Black community for them to in turn go out and hire people and spend money within the Black community. And at the end of the day, I always say we can empower our community, meaning the Black community. It makes for greater Quad Cities at the end of the day.
Tell me, though, about the Business Giving Circle, because that's kind of an expansion of that idea outside your walls.
Outside of our walls, yeah. So Business Giving Circle, I will say, we have to, more people have to know who we are and what we're doing. Once we get to that point, which I think we're getting there now, the Business Giving Circle is an opportunity for the entire Quad City business community to give back, where they can pledge $1 a day for a year, so that's a $365 pledge, or $100 a month, which is a $1,200 pledge. And all that money goes directly back into not just the Lincoln Center, but into the community, because those are the people that we are working with. So we're hoping to kick that off next year.
Okay.
Yeah, and get as many businesses as we can to get involved and be a part of what makes the Lincoln Center grow.
You did mention the fact that where the Lincoln Center is located is, and we didn't use the term, but it is an interesting term, is food desert.
Mm-hmm.
And we're seeing it pop up. There's a website that shows the circles, as you said,
8 miles.
Yeah, well, just under 2 miles, and where it showed food pantries and where it showed grocery stores, and you could see these areas where there's just no way to get to a food supplier quickly.
I'll tell you, when I first started working there, I grew up on the west side of Davenport.
Mhm.
So, and I was still living on the west side of Davenport at that point in time, so not too familiar with that area. And I remember one of the first days I was working there, I was like, oh, I need a Diet Pepsi. And I went outside to my car. I'm like, wait, where am I going to get one? I had to drive all the way up to Locust, and I have a car. So it was easy for me to turn around and just drive up to Locust and find somewhere to get a Diet Pepsi. But a lot of people don't have reliable transportation.
Mhm.
But then there's nothing around anyway.
Yeah.
You know, you do have to go quite a ways to get it. And I get that there are food pantries, but those aren't even as easily accessible as being able to just go to the grocery store.
And some are open for a short period of time or just certain days.
Or
but
it's first come, first serve. And so if you're not there, then you're missing out.
But you add to the fact that, I mean, we know that this is capitalism, but Hy-Vee is announcing that it's closing in one of the most important areas.
Yep, Weston.
How's that, do you think, going to impact food insecurity for the people that you serve?
I think it just makes it even more challenging. And so then it takes people, not just the Lincoln Center, but other nonprofits in the area, to really be that resource for these families. Most families, it's hard to ask for help. You know, usually
There's
that's
pride.
a last, exactly. And usually that's a last resort, is to ask for help or find out where the nearest food pantry is, or to ask for any type of vouchers, or to try to get some food assistance. That it is really hard to do. And so we have to be caring, we have to be understanding, and we have to do our best to try to provide them with the resources that they need.
I want you to talk a little bit about contact information for the people that may be watching, or they know somebody. You know, how do they contact you, or do you just walk into the office? You know,
it seems like that happens a lot.
Because like you said, there's pride, and people may not ask for help. They may not know that the Lincoln Center is there and available.
Yeah. So we are on Facebook, and we do have a website, the LincolnCenterQC.org.
It's a great website.
Yeah.
Filled with information.
There's a lot of information on the website, but yeah, we do get a lot of people that just stop in. And we're a community center. We're not a social service agency, but I try my best to make sure I have all those resources available, so that if they do come in and ask for something that I don't have the resources for, that I can then point them. And I'm not just going to tell them, oh, go here. I'm going to make the phone call. I'm going to go over there with them. I'm going to make the appointment for them, because I want to make sure that they're getting everything that they need. Once again, I've been there. So I want to do my best to help people figure out how they come out of whatever situation they're in.
Tracy Singleton, the Executive Director of TMBC at the Lincoln Resource Center. In a moment, a faster way to get blood for people who need it the most. But first, Jenny Lynn Stacy says she supplies an eclectic and comforting array of melodies strung together with love. She brought some of that array with her when she performed one of her originals at the Black Box Theater in Moline. Here's Jenny Lynn Stacy with I Prefer It.
Hello was my name. My heart was much the same. Thankfully, my mind sorted out. give me breaks. Thankfully, my heart sorted it out in time for a better day. In time for a better day. When you found me, I was feeling cold. What could you do to me? Hell, I do not know. But I love you, I say it all the time, and I prefer it this way. Oh, I prefer it this way. Oh, I prefer it this way. And I must be excused. My mind's gonna lose it. Regretfully, I have gone off the trail in time for a better day. In time for a better day. When you found me, I was feeling cold. What could you do to me? Hell, I do not know. But I love you, I say it all the time, and I prefer it this way. Don't you need me? Is this all way too fast? I'm not the easiest to love, hell, I do know that. But I dig you, I say it all the time, and I prefer it this way. Oh, I prefer it this way. Oh, I prefer it this way.
Jenny Lynn Stacy with I Prefer It, performed at Moline's Black Box Theater. Research finds early blood administration by emergency medical services to patients suffering from hemorrhagic shock improves outcomes. Now, the Blood Center, Impact Life, is partnering with first responders like those who operate Life Flight helicopters to make sure these so-called pre-hospital transfusions are possible. I spoke with Kirby Wynn of Impact Life about these changes and the impact it will have on blood supplies. So tell us a little bit about this change for first responders. The importance of getting blood transfusion before the patient even gets to the hospital seems like a no-brainer.
Doesn't it make sense?
Yeah.
It's funny you put it that way, because our chief medical officer, Dr. Daniela Hermelin, is saying that too, that she's been in conversations with her son about what she's doing at work. He's responded by saying, well, wait, it's not already that way? But yeah, it is pre-hospital transfusion, really an innovation that's paradoxically maybe been around for a long time.
Yeah.
A long time on the military side. So battlefield injuries, care of injured soldiers with blood loss, even going back to World War II era, patients have received blood transfusions on the scene of that emergency, and then bandaged up and taken en route immediately to higher levels of care. It's just now, more recently, that we're seeing this develop in the civilian side of emergency medical services.
Is it because there's a greater use of a more universal blood type?
It's really learning that patients do better when they receive blood sooner, as opposed to, say, like a saline.
I see.
Previously, someone with blood loss, the emergency medical services team would work to stop the bleeding, find the source of bleeding, stop it if at all possible, and then give some kind of a fluid, but not blood, because they didn't have it on hand. What they've learned is if they can give a blood transfusion sooner, before the patient reaches the emergency department, the patient is going to do better, number one, but also possibly even receive less blood overall, including those early units, and get to go home sooner. I mean, we are hearing stories from some of the folks that we work with about really positive outcomes that they've seen.
Well, and I want to talk about one of those in particular, because you brought them up in regards to a man in the St. Louis area. But
Yeah.
before we get to that, I mean, I would think it's an issue of storage. Is that the major hindrance in the past as far as having blood supplies for first responders like Life Flight helicopter operators?
Sure, storage is a big part of it. Certainly also just getting it from the blood bank and having it on hand, managing the inventory, the number of days that it's available until it expires. All of the protocols that we've handled for years within hospitals now are being developed with EMS agencies. And so I think the biggest part of it is developing nationally accepted standards and protocols that will help make this a process that can be adopted across the board. And that's still underway. That's something that's being advanced by the Association for Advancement of Blood and Biotherapies. Our own Chief Medical Officer, Dr. Hermelin, is part of that effort. So in the meantime, she's working individually with those agencies that want to adopt the practice.
She is based in St. Louis.
Yes, that's right.
And tell us about the St. Louis man who seems to have gotten the life-saving transfusion and made all the difference in the world.
That's right. I will tell you a little about it. I want folks to know that you can view the whole story in a video we have on our website at bloodcenter.org. Go into the news section and look for pre-hospital transfusion, and you even see an interview with this particular patient, with the deputy chief from Melville EMS who responded on the scene and delivered the blood transfusion. But this is a person who experienced bleeding at home. It was a varicose vein, actually. I wasn't aware, but sometimes a varicose vein on the outside of the body on the leg can open up and bleed. And usually isn't a major issue, but in this case it was. There was significant blood loss. He was deteriorating badly when the crew arrived. But the deputy chief, Adam Hager, had blood available. They had sorted out what they needed to do with storage and transport. He had it on the scene. And he talks about, I gave that blood transfusion and saw him respond right away. Color returned, his mentation and ability to communicate improved. They, of course, did stop the bleeding, brought him to the hospital, and he was home after a short stay and really doing very well.
We are in the summer months. This is always your push. Blood centers all around the area where you see students are home, so you don't have as many blood drives, which is always a great bank of blood as the students and these rallies.
Right.
So what is going on this summer? Because I know that oftentimes Impact Life does, special giveaways, special incentives, everything, just to get people in through the door.
Yeah, well, a combination. The donors who come see us, and it really is a critical time of year. We're going to have everybody a voucher to say thank you. And by the way, people come and give blood for, the main reason is just to help others, not to put something in their pocket. But as far as that goes, they can redeem that voucher for a choice of an electronic gift card. Comes in your email from a variety of different vendors the donor can choose. That's a $20 item, or the donor can choose to get points that they can spend in our donor reward store. And that's for, swag. You could look like me. You could be wearing
and who wouldn't
Blood
want
Center
that?
Apparel. We really should offer suits.
Suits and ties. Yeah, exactly.
Like yourself. Or we have a third way, which is to make a donation, a charitable contribution. So that same value that you could receive in a gift card, you could donate. In this case, we're working currently in this quarter with Best Friends Animal Society to support animal welfare programs. So some options there.
The last time I talked to you with some regularity was, of course, during COVID-19 and the real problems with the blood donations right then. Has the Blood Center rebounded like so many other segments of society since the pandemic ended?
Yeah, I think like many other segments of society, it's most of the way, but not entirely with that rebound. So early pandemic, most groups that could schedule a mobile blood drive and have us come to their facility, those were off. Schools were out. Even manufacturing sites that were still operating, no visitors here under our new policy in COVID, so they called off blood drives. Now, many or maybe even most of those are back, but some organizations that hosted blood drives pre-pandemic don't even exist anymore. They're just not an option for us, or they got out of the routine of having us come for a blood drive and just haven't gotten back. So yeah, the appeal, and honestly, it is making summers more challenging because we were always kind of at that line, and now it's just a little bit harder than what we remember, what we had from before 2020. And so, if there are groups out there that would have us in for a blood drive this summer, please do contact us, Impact Life, at bloodcenter.org, and we'll talk. We'll work something out.
We always talk about incoming blood and not so much about outcoming blood. And news just came out that Unity Point Health in Iowa is changing to a different blood service. It is called LifeServe, based out of Des Moines.
Right.
How does that impact life? I mean, you'll have fewer hospitals than to serve. Does that mean your blood supply, I don't know, when it comes to supply and demand, actually increase?
Right. There's an element of this change, which is, of course, a big change that frankly, we're disappointed about it. It's not the outcome that we wanted to see, but it is a trend in healthcare systems to have a sole provider wherever they can, a single provider relationship. Throughout the state of Iowa in the past, you had Unity Point Health hospitals served by LifeServe and other Unity Point Health hospitals in the eastern end of the state.
More your territory.
Yeah, exactly, yeah. So what we're seeing is a health system making a decision as a health system to work with a single provider. But I bring that up because LifeServe themselves, we expect that they will need help. Adding, you're right, in the sense that Impact Life may be a little bit less strain on blood supply, although certainly nationally there is a market, a demand for blood in a lot of places that we can serve. But we know even here in our region, LifeServe, we have a connection and relationship over many years. We're already in conversation about supporting their inventory needs from our own blood supply. And that's something we'll be able to do, based on inventory levels and, as you say, blood going in and blood going out. So this is a change that we're now adapting to, but a piece of it really could be supporting local needs through the new supplier, through LifeServe. We're also mindful of the needs of other regional locations where people from the Quad Cities may go for healthcare. University of Iowa uses blood components at their hospital at the university from Impact Life. Patients who are referred maybe on to Peoria and the big OSF healthcare facilities there will also, all of their blood comes through Impact Life. So we are adjusting to this change, but it is something new that we're going to see how it all unfolds.
Kirby Wynn, Public Relations Director for Impact Life. To learn more about upcoming blood drives or how you can organize one, visit bloodcenter.org. On the air, on the radio, on the web, on your mobile device, and streaming on your computer, thanks for taking some time to join us as we talk about the issues on the cities.
At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial health, and we are here. IHM VCU is a proud supporter of WQPT.